Hello, Mr. Kirby.
Hello.
My name is Charlene. I am going to be a student nurse practitioner today. My understanding is you're here for a physical assessment. Is that correct?
Yes.
Do I have permission to perform that assessment?
Yes.
Are you okay with me touching you?
Yes.
Okay. I am going to put them on a thermoscope. Wash my hands with hand sanitizer. And I am going to perform your eye exam with my ophthalmoscope. I need to dim my lights first. I'm going to ask you to look over my right shoulder as I align my left eye with your left eye up and over my right shoulder. I see your red reflex a little closer. I see your optic disc and your blood vessels. I'm going to come to your other eye, placing my hand on your shoulder again. I'm going to ask you to look up and over my left shoulder as I align my right eye with yours and the ophthalmoscope. I see your red reflex. I see your optic disc and your blood vessels. Great. I am now going to utilize my pen light. I'm going to shine this light into your eye, into each eye twice. Okay?
Okay.
Just look forward for me. Direct constriction, consensual constriction, direct constriction, consensual constriction. Okay, I will cut our light back on. Okay. Next, I will look into your ear canal, okay?
Okay.
All right, so I am looking. I don't see any obstructions or any drainage or cerebral impaction in your ear canal. I'm going to examine my otoscope. So I'm looking in your ear canal, pulling your ear up and back. No cerebral impactions. I see no obstructions, no drainage. And I do see your tympanic membrane in the cone of light. Now I'm going to take my ophthalmoscope and observe the other ear, pulling your ear up and back. I don't see any obstructions, any drainage, any cerebral impactions. I'm putting my ophthalmoscope in, and I do not see any obstructions in your ear canal, no abnormal growths, no drainage. I see your tympanic membrane and the cone of light. Thank you, Mr. Kirby.
You're welcome.
Next, I will be performing a hearing test. So I'm going to place this fork on your head, and you tell me if you hear it in right ear, left ear, or both ears.
Both ears.
Great, Mr. Kirby, thank you. Now I'm going to take this fork again. I'm going to do the same thing, but I'm going to put it on your bone behind your ear. Tell me if you hear it, and then let me know when it stops, if you hear it. Do you hear this?
I hear it.
Okay, let me know when it stops.
It stopped.
Okay, do you hear it now?
Yes.
Let me know when it's, okay, and thank you. So now I am going to do your other ear. Let me know if you hear it.
Yes.
Tell me when it stops.
It stopped.
And do you still hear it?
Yes.
Great. So your hearing test is normal. That's normal findings that air conduction is greater than bone conduction. And you can hear laterally in both ears. All right, so Mr. Kirby, I am now going to look into your nose, actually. I'm going to remove my nozzle from my ophthalmoscope and replace it. And I'm going to take a peek in your nose. Can you tilt your head back a little bit? Okay. All right. And then look in your other ear. Okay. It is pink and moist, no deviated septum noted. I'm going to remove the tip of my otoscope, and I am going to use my light to look into your mouth. Okay, pink and moist. Lift your tongue, please. All right, and all dentation is noted. Okay. Now, Mr. Kirby, I am going to examine your thyroid. So I'm going to stand behind you, put my fingers right near your throat, and ask you to swallow. And I feel it rise and fall, which is a normal finding. Thank you. Now I'm going to examine your lymph nodes. So I'm going to begin with your occipital. Can you please turn facing me, please, so that we can get this on a camera. So at the base of your skull, your occipital lymph nodes. Okay. Then I'm going to do your preauricular in the front of your ear, postauricular right behind your ear, anterior cervical chain with all 4 fingers, posterior cervical chain with all 4 fingers, deep cervical chain with all 4 fingers, tonsillar, submandibular, submental, and supraclavicular right above your clavicle bone. And no lymph nodes were palpated, which is a normal finding. Okay, Mr. Kirby, I'm going to ask you to please turn around and face the pictures. Okay, next I'll listen to your heart. Listen to your heart in 5 different places, okay?
Okay.
And this will be done on skin to skin. Just breathe normal. Aortic, pulmonic, Erb's point, tricuspid, and mitral valve. Great. All right, Mr. Kirby, I am now going to listen to your lungs on your chest. I'm going to listen in 6 areas, 3 locations. Every time my stethoscope touches your skin, take a deep breath in and out slowly. Okay. Great job. Now I am going to percuss, or tap on your chest with on top of my finger. This won't hurt at all, in the same 6 areas. Okay. Okay, Mr. Kirby, I'm going to ask you to turn around and face the clock, please. I'm going to do the same thing on your back. I'm going to listen on your back in 8 different areas, 4 locations. And then percuss in the same, or tap on your back in the same areas. Take a deep breath every time my stethoscope touches your back. Okay, great job. All right, Mr. Kirby, you'll feel me touching your back. I'm going to tap lightly. It'll be over my finger, so this should not hurt. Okay. All right, Mr. Kirby, next you'll feel me palpating your spine, or I'm going to feel your spine. Let me know if you have any pain, if you feel any tenderness or pain. Okay. Last on your back, I am going to tap on your lower back. Please let me know if you feel any pain. I'll do this on each side. Okay, great job. Can you please turn around and face the pictures, please? All right, Mr. Kirby, I am going to check your pulse, your radial pulse simultaneously, comparing the two. Okay. Now I'm going to check your pedal pulse, simultaneously comparing the two. Okay. While I'm down here, I'm going to ask you to push down on my hands and then push up on my hands. Great. I'm going to perform hand hygiene since I touch your feet. Okay. I'm going to put my hand behind your legs. Can you please pull back, resist, and then kick out? Great. I'm going to ask you to pull up and down, and then up and down. Great job. All right. Can you hold your arms up for me like this? I'm going to push. I want you to resist. And then as I pull, resist. Can you please squeeze my fingers as tight as you can? Great. All right. Hold your hands out. I'm going to push down, resist. And then I want you to push up. Great job. You can relax your arms. Okay, please shrug your shoulders up. Great job. Okay, Mr. Kirby, I am now going to test your reflexes. Okay, if you can just give me your arm. Nice and loose. Okay. And this is your tricep I'm testing. And both arms. Relax. Okay. And then I'm going to test your bicep and both arms. So just relax. Yep, relax, loosey-goosey on your. Okay, and your other arm. Relax this arm as well. Okay. Now I'm going to test your radial brachial reflex. And both arms. All right, now I'm going to test your Achilles reflex. Okay, and I will relax your leg. Okay. So I did also want to mention that my examination of your lungs on your back would have been done on skin as well, just as I did the front of your chest on skin. Okay. And I'm sorry, your patella reflex would be done on skin as well. So just relax your leg. Okay. And okay. All right, sir. Let me see. Next, I'm going to ask you to lay down on my hospital bed. And I'm going to do your abdominal assessment. Okay. So I'm going to just listen to your abdomen. You just can breathe normally, okay?
Okay.
Okay. Next, I am going to tap on your abdomen, okay, over my finger. Okay. Next, I'm going to touch your abdomen and push in very lightly, and then I'm going to push in deeper. Let me know if you feel any pain. Let's see, you're ticklish, Mr. Kirby. Okay, that was light palpation or light touch. And now I'm going to do a little deeper. Don't feel any mass or any abnormalities. Okay. All right, Mr. Kirby. I'm going to ask you to stand up for me. Take your time standing. How you feel?
Okay.
Not dizzy or anything, right?
No.
Okay. Put your legs together, please. Hands by your side. I'm going to ask you to close your eyes for 30 seconds. I'll stand right here in case you lose your balance. Okay, and no swaying was noted. You can have a seat, Mr. Kirby. I'm going to take a look at my notes, and I'll be right back with you in a second. Okay, Mr. Kirby, I believe we are all done with our examination. I am going to go and talk to my preceptor. We'll come back and review the findings. Okay?
Okay.
Is there anything I can get for you?
No.
All right, I'll be right back.
Okay.